We're going to be talking about how to help respiratory issues today. And all about supplementation, answering all your questions about it. All right, first thing first, I'm Maggie Yu, MD. I am a functional and holistic medicine physician in practice over, we're near 24 years, and I'm dating myself right now. And our Facebook group is Transform Autoimmune Disease Naturally. If you have not joined it, go ahead and just in your Facebook tab, check out Transform Autoimmune Disease Naturally, and where I go live with a lot of trainings, and it's a kick-ass community. We're currently almost at 32,000 in our community, in our Facebook group, Transform Autoimmune Disease Naturally. So go ahead and click and join. Today, we're actually going to be talking about respiratory symptoms. There is a multitude. I almost feel like there's a perfect storm of issues right now, conglomerating around symptoms around respiratory issues. And respiratory issues can be related to asthma, allergies, upper respiratory infections, COVID, and we're adding to that mix the wildfires that's hitting our entire west coast of the United States, where I'm at right now. So there really is almost, to me, the perfect shitstorm of triggers and exacerbation of respiratory symptoms. And I'm not even including some in our audience are dealing with respiratory issues relating with autoimmune disease. There's a lot of autoimmune diseases that actually can affect the lungs, and it can cause chronic shortness of breath, inflammation, and scarring in the lungs as well. So for me, I think this segment is really important, and it's all about lung protection or dealing with flares. Think about all the different types of flares that are going on right now. And, oh, awesome. Danica saying hi. Kendra, hi everybody. Let's see. Belinda, oh, I'm seeing alumni. If you're an alumni and you're watching, can you tell everybody in here that you're alumni? That'd be awesome. And tell me what's happening with respiratory issues in your area right now. If you can tell me in the comment section, that'll be awesome. Really appreciate that. All right, let's go to why do I call this the perfect shitstorm right now for respiratory conditions? It's because, think about it, we are in September. Okay, we're in September, which we're talking about transition. We're going from summer and into early fall. And this is when we're going to traditionally be starting to see also increased mold exposures with some increase in precipitation in much of the United States. Now, allergen issues from summer is also continuing to be an issue. And with the climate changes that are happening, we're seeing that allergy seasons are getting extended. So it might be just spring or summer, and now we're seeing things year round. So right now it's not uncommon towards the end of summer for people with allergies to have increased asthma symptoms and allergy sinus symptoms continue. Now, added to this right now is the extreme weather conditions we have in the western United States with wildfires. We are having hazardous air quality in the western United States. I'm in Oregon, and you're looking at Washington, Oregon, California, all the way affecting also into other states, including Nevada, Colorado, Utah. Air quality is being affected. So we're seeing hazardous air quality conditions right now, which is causing a lot of people to have headache, worsening of their lung symptoms. And when you're dealing with hazardous air exposures, a lot of toxin exposure right now. So this is a serious time for respiratory symptoms. And I would love for you guys in the comment section right now, if you're dealing with any of these issues I'm talking about, or your family is. You got children going back to school. Some of you guys have kids that are going back to school. Some of you work outdoors and are experiencing more of these symptoms. Tell me what your exposures are and what you're experiencing right now. That would be really helpful in the comments, all right? Now, let's talk about supplementation, because today we're going to focus on supplementation. And there is a lot of data actually around supplementation that are helpful with respiratory issues. And I'm going to go through some of them, and I'm going to educate you guys. I've done the legwork. I've seen the data. I've used these in my practice as a functional holistic physician. We use this in our program, Transform Autoimmune Disease Naturally. We have a program, and we also have another program called My Hormone Masterclass. So we have several programs as well, and I've been teaching about the supplementation and using them in my practice and in our programs for a really long time. So I wanted to first talk about, first of all, what is in Sinuplex. Oh, you know what I'm going to do? I'm going to flip the screen so you guys can actually see the writing on this. Give me 1 second, okay? There we go. Can you guys read this now? Or did I have this backwards? Oh, it was fine before. All right, let me fix this. Give me a second. This is what happens when you're live. Does this read? Perfect? Okay, Sinuplex. Why do I like Sinuplex? Well, first of all, it's not an expensive supplementation, okay? Not every supplement, quality supplement, has to be expensive. But the formation of it, the absorbability of it, the combination of either vitamins or herbs in it has to really work really well for me to say this is something that's worthwhile to take. Why do I like Sinuplex for respiratory symptoms? Well, if you look at the ingredients, first of all, it's a company I really do love. Secondly, main ingredient here are vitamin C, quercetin, stinging nettle, and NAC. And I do want to do who wants to learn more about these ingredients and why and how they work. I'm all about education. So let's talk a little bit about vitamin C, okay? Vitamin C is a component of Sinuplex, but if you really want high dose vitamin C, I do recommend our ultra potent C. We have an adult version of this and we have a chewable version for kids. Vitamin C is an antioxidant. What is an antioxidant? Antioxidants prevents cell death. Oxidation is oxygen's attack on cells that cause them to burst and get destroyed or irritated. So if your cells are full of antioxidants, you're preventing cell death, apoptosis, cell death, okay? And so loading your cells up, respiratory tract or immune cells with high doses of antioxidants to protect those immune cells or allergy protection cells, it's really important. And the problem is that vitamin C is very acidic. So it's hard to tolerate the doses that we see. The data around vitamin C is you got to get high doses daily as a prevention, and when you're in a flare, really high doses. So you can't just go and buy like a vitamin C from your local pharmacy or something and expect to be able to take these high doses. Vitamin C needs to be buffered and needs to be absorbed and tolerated at these high doses. So for me, it's really important if you're going to be taking vitamin C, it's part of our antiviral line. We have an antiviral line and I have recipes in there on exactly how to prevent upper respiratory infections and what are the right doses to treat. So our team is Cora's putting a link there for our antiviral line with which vitamin C. We have a prevention dose and we have a treatment dose. But when you're talking about why vitamin C is important in Sinuplex is that it is an antioxidant, so it prevents cell death. The other thing is vitamin C actually has a secondary mechanism. Vitamin C can actually activate cells that actually eat up infectious cells, and these cells can also eat up a lot of dirt and grime, okay? So if you activate these phagocytes, they can do cleanup really well, and they can eat up allergens and also viruses or bacterial infections really well. So that's why I love having the vitamin C that's in Sinuplex. If you're talking about one product, if there's one product I would take right now, it's Sinuplex. Secondly, so there's vitamin C in here. Quercetin is incredible. Why is quercetin important is I think it's one of the most powerful supplements that you can take to actually help boost your immune system and balance it. It's actually not just good for respiratory system, it's really helpful for what the mucosal tract is, which is your mucosa is the back of the lining of your mouth, your ear, nose, and throat, and your gut. So quercetin is incredible. Stinging nettle is in here, and stinging nettle is the one herb that's incredible for actually decreasing allergen response. So I have clients will be drinking stinging nettle tea. Interestingly, if you actually have stinging nettle in the wild, you can collect them and actually cook them as well. People eat them as well. But stinging nettle is in here really great as an allergen additive to this product. And then as well as NAC. NAC I cannot talk about enough. NAC is really important to activate liver, okay? Your liver is a really important part in detoxifying your body to get rid of toxins. So all you wildfire exposure people, you want a ton of NAC, and NAC is a big component in Sinuplex, and it's also a big component in our product called Liver Love. But Sinuplex, if you're talking about one product specific to respiratory symptoms, is great. And what I do with Sinuplex, honestly, is I will take, if I'm in the middle of an asthma flare or I'm in a wildfire exposure zone, which is what I'm currently doing, is I take 3 of these in the morning, 3 of these at night. 6 a day is what I usually take during flare season. And then if you have a low-level symptoms around other times of the year, you just take 2 a day and that's it. So this is incredibly helpful. It's not an expensive supplement, but the combination I find works really well together. Better than if you bought the components and took it separately. So Sinuplex, and there's a lot of people in this group and in our programs who already take it. And if you've had good feedback, we've had tons of great feedback on it, go ahead and comment in the comment section below. So that's Sinuplex, and I would, and this is something I currently have been taking like crazy because of the wildfire exposures. Now, but it is also part of our, in our upper respiratory infection line, antiviral protection. Sinuplex is an add-on for people who are not only trying to prevent upper respiratory infection, but are dealing with asthma or allergies. Go ahead and add this on to your viral protection. I would take it daily, 2 a day. Unless you're in a flare, then I would do 6 a day. Now, we'd already talked about vitamin C. I've made other videos on vitamin C. So if you're interested in watching it, we have a whole unit on COVID, and we did specifically talk about vitamin C. And by the way, if you go to our link for our antiviral page, I specifically give adult and pediatric doses for each of these supplements. Number one, to prevent upper respiratory infection, and number two, the treatment doses for treating of symptoms in upper respiratory infection. So they're different dosing, so it's really important for you to take a look at those recipes, and I have recipes for adults and kids on that link. Now, something I'm thinking of right now, especially with wildfires, for people that have bad air quality exposures right now, definitely look at Liver Love, okay? And I'm going to talk about just components in liver supplementation that's really helpful, especially with dealing with wildfire exposure, okay? Dan's asking a question we have links in our comment section of where you can actually take a look at the supplements that we're talking about, and it's, just look in the comment section, everybody. Now, Liver Love. What is so amazing about Liver Love is it's actually a combination of herbs I love. They're my favorite for actually helping your liver detoxify, get rid of toxins. Toxins can come from the environment, from air quality exposure. It can come from the environment in terms of food. What if you're ingesting toxins in your food, right? As far as herbicides, pesticides that are in your food, right? For environmental, like contaminated exposures from water, well water, different things. So it's also great for when viruses and bacteria die in your body, they burst. When they burst, they actually release a ton of toxic substances your body does not like. So what actually detoxifies your body is your freaking liver. And I cannot overemphasize how important the liver is. And in fact, liver detoxification is a huge part of our program, My Hormone Masterclass. And I think liver is the missing connection, is the holy grail of our hormone balance that people don't realize. But we're talking today about toxin exposure. So what is so awesome about Liver Love is that we're looking at ingredients of, number one is milk thistle. Milk thistle is a very liver-loving herb, and you really want to have the active parts of the plant involved. So it's very high dose milk thistle in here. But it's the others. What I love about it is the other things that it has is NAC with milk thistle, and then you also have selenium and ALA, and those actually the combination of the four is an incredible powerhouse for liver detoxification and Liver Love. And typically on Liver Love, what I tell people to do is if you're in the middle of an exposure or a flare, there's some sort of, you're in the middle of an infection, or you're dealing with some sort of acute air quality exposure right now, we are right now in Oregon, I would do exactly what I just said, which is 3 in the morning, 3 at night, 6 a day is really good. And then for maintenance, or like after let's say the air clears up, but it's still low level of it for another 6 weeks here, which is possible, I would take 2 a day of that. So 6 a day when it's really bad air quality, and after that 2 a day for kind of maintenance until you feel like you're no longer exposed or you're no longer dealing with it. So it's not something you have to take permanently, but it's great to have on hand when you're dealing with toxic exposures or dealing with an infection and killing an infection that releases toxins. Is that clear to everybody? Okay. Simone says that stinging nettle grows in her yard. Yeah, you can totally stir fry stinging nettle. You can also dry the leaves or have fresh leaves and make a tea with it, which is really awesome, okay? And T is asking, is Liver Love okay for people with tachycardia? Yeah, in general, supplements that I'm talking about are really well tolerated. But again, if you think about supplementation, you can be allergic to any supplement just like you can be allergic to any medication. But at the same time, the difference is that medications, pharmaceuticals can cause a whole lot of side effects, some of them life-threatening, whereas supplementation, there could be sometimes side effects associated with it. Most of the time, I'm more worried about allergy response to any sort of new medication or supplementation, which is why for me, you always want to start one supplement at a time, or if you're starting a medication, one medication at a time. You don't want to add 3-4 things at once, so you can troubleshoot in case something happens. Has this been helpful so far? So we've talked about vitamin C, which is really important, and there's doses for dealing with prevention of infection in vitamin C and an acute infection or flare. And you definitely want, to me, I'll be honest with you, this C is the best I've ever used. Because when let's say I'm dealing with upper respiratory infection, the kind of dosing you're talking about vitamin C is 10,000 milligrams, which is 10 of these bad boys a day. So let's say I started an infection, I'd be taking 2 almost every couple hours until until I get to like 10 of these a day. It's really high doses of vitamin C for dealing with infection, like acute infection symptoms, or dealing with like a big toxic exposure flare. So you definitely want a high quality C that's buffered. And then we also have on the C a chewable for kids. So there is also kid dosing involved. So you can go on our antiviral page and we talk about the C dosing. I've talked about liver love, which is really great in general for any time you need to detoxify. And then we talked about Sinuplex. I hope that was helpful. And that is, we did have, Kim did ask, she said that when she has asthma, should she be just taking her rescue inhaler? And the answer is hell no. Because the thing is that rescue inhaler implies that you need to be rescued. To me, it's really important. Of course, in our program, we deal with how do you actually, with our food mapping process, how do you actually decrease allergen load? That's going to be really important. But regardless whether they're allergy with gut symptoms or lung symptoms, decreasing the source of the allergen is really important no matter what where the source is coming from. However, when we're dealing with asthma, rescue inhalers and the dependence on them to rescue you is not the way to go, because a lot of times I look at it as if you have severe asthma where you're already in the middle of a flare, pulling that bowl once it's out of the pen is really difficult, whereas prevention is way more effective. And overall, you never get into that triggering that actual bulge up going out of the pen. You and I have asthma, and when I'm asthmatic and I'm already coughing my lungs out, it's too late. It's really hard to pull that baby back. And at that point, you're dealing with tons of pharmaceutical meds, including steroids. So the way to actually deal with asthma, especially in light of a lot of the triggers right now, is prevention is really important. I actually have my son and people in our program with asthma symptoms, so possible asthma symptoms during their trigger season. We'll take 2 of these Sinuplex every single day as prevention. It works extremely well for asthma, allergies, chronic sinus people, infection, those kinds of things. So prevention to me is a way better way to go when we're dealing with asthma, because you don't want to be rescued, okay? You don't want to need rescuing. Prevention is really important. I hope that was super helpful. I'm just jumping in to give you guys a quick training on Ask Me About Supplements. Today we're really focusing on respiratory symptoms. If you can go ahead in the comment section, tell me what was the biggest takeaway here. Can you tell me in the comment section what is your biggest takeaway so I know what was the most helpful? That would be really great. And okay, and that's awesome. Any other questions? I think we're good. All right, everybody, have a great afternoon.